Welcome. Come with me. The doctors will see you now.
Welcome back to another episode of Fast Talks with Family Docs. I'm Dr. Phil Palmer.
And I'm Dr. Veer Vidala. One thing we love about family medicine is how flexible and far-reaching it can be. We're trained to handle a lot of things from newborns to geriatrics, preventative care to procedures, chronic diseases to acute emergencies. And in many communities, especially in rural settings, family doctors are the emergency department. So today we're diving into that world, the world where the overlap between family medicine and emergency medicine really shines. So how do family docs really prepare for the ER? What kind of training or fellowship opportunities exist? And how do these broad continuity-focused skills translate to the fast, high-pressure world of acute care? Joining us today is Dr. Michael Kouandjio, a double specialty trained physician in emergency medicine and family medicine. He's board certified in family medicine and completed his emergency medicine fellowship in Oklahoma City in 2023, following residency in South Carolina. Dr. Kouandjio's path is anything but ordinary, from earning a degree in aviation science and serving 6 years in the U.S. Air National Guard, thank you for your service, sir, to building a career in accounting before medicine. Born and raised in Cameroon, his story is one of reinvention, resilience, and purpose. Beyond the hospital, he's also a passionate content creator and educator, translating complex medical topics into approachable, relatable insights to the public. When he's not saving lives or creating content, you'll find him hanging out with his wife, Jennifer, and his 2 pups, Cessna and Blue, or behind a drum kit on game day. And fun fact, he has 2 younger brothers who are retired NFL players, so you could say excellence runs in the family. His work in the ER settings, where every shift looks different, is where the depth of family medicine training truly shines. And whether you're a resident just starting out or a seasoned doc looking for new challenges, I think this episode is for you. Dr. Kouandjio, thank you for being here, sir.
Well, thank you for having me. What an introduction. I love it.
Yeah,
Thank you so much.
It's nice to have you. And even though your brothers played football at Bama, I'm guessing if you have a drum kit on game days, it's for football, right? Are you a soccer fan?
Of course.
Is that where you're playing the drums?
I'm a big soccer fan. Played a little bit growing up. Played some in high school, but yeah, love soccer.
Excellent.
That's so cool, sir. So Dr. Kouandjio, tell us about how you got to the ER. Like, as a family doc, what interested you in emergency medicine, and how did that career path look like?
I think I fell in love with emergency medicine when I was a resident, actually, when I was a family medicine resident. That's really when I fell in love with emergency medicine. But it happened really early during my residency. I think my first ER rotation in family medicine residency was my 3rd rotation. I did very well in the rotation, fell in love with the specialty, and ended up finding my way into the specialty. What really happened was that during residency, I think your question was, how did I get it? Yeah. So during residency, fell in love very early on, decided that I was going to follow that path, but I did not want to give up family medicine. Sure. Yeah. I wanted to have the flexibility. I wanted to have the knowledge that comes with the training, the family medicine training. So I did not want to completely give up on family medicine. So during residency, I started doing a bunch of emergency medicine rotations. All my electives, 100% of my electives, were in emergency medicine or emergency medicine related specialties like ultrasound.
Amazing.
So I did all of that in residency. I did some ICU rotations in residency, so I could some extra ICU rotations in residency, so I could get more comfortable with procedures. Some of the heavier procedures like chest tube placement, placing lines. So I did all of that in residency to prepare me for once I'm out of residency. So then after residency, I did a fellowship that lasted a year where I got additional training. And then I'm here today working as an ER doc. Yeah.
Excellent. And now, I think the other thing from my limited experience in working in the ERs is there are certainly some metro areas, some urban areas across the country where the emergency room is like some emergency rooms you see on TV, and you're seeing gunshot wounds and major traumas coming in very frequently. But my experience in the emergency room with a resident, as a resident rather, was yes, that happens occasionally, but it was a lot of family medicine clinic in the emergency room. People coming in with gyne complaints and coughs and ear infections in kids and different things like that. That it certainly are a lot of interventional things you do need to have a grasp of as an ER doc, but there's a great deal of family medicine.
Absolutely.
Not so much family medicine, but primary care type things in the practice of emergency medicine. I'm curious, as you went through that as a resident, what mentorship, if any, did you have? Was there another family medicine doc heavily involved in ER, or did you connect with other ER docs? And then there's a lot of places that depend on family medicine doctors to run their ERs and to be their ER. Again, primarily in rural areas. In the past, even in urban areas, it was primary care docs and family med docs running the ERs. With more emergency medicine programs, there's been more of a shift in urban areas that you have to have more of an emergency medicine certification to do it. But back to where I started. So as you were going through as a resident with your strong interest in ER, did you find any mentors to help you in that process? And what led you to the fact of saying, I don't want to just go practice in an ER, I'd like to do a fellowship before I go and practice?
Okay. Yeah, absolutely. So I did have a bunch, I kind of don't want to mention a lot of names, mention names here because I don't want to leave anybody out.
Yeah.
But since I already knew that I wanted to go into emergency medicine, all the attendings in the emergency department where I trained knew that I was interested in going to into emergency medicine. I made it clear to them because where I trained, the hospital where I trained also trained emergency.
Had a program for
it did. So I came in and I let them know that, hey, I wanted to go and get into emergency medicine. Please take me under your wings like you do your residents. I want to do the procedures. Please treat me as an ER resident and not as a family medicine resident who's just doing a rotation. Right. So doing so helped a lot because they knew that I was really genuinely interested in emergency medicine. So they took pleasure into teaching me things and really treating me as a ER resident. Okay. Yeah. Okay. So that helped a lot. But I did have a couple of attending that really took I would say care of me.
Okay. Yeah.
Attendings that I would really consider mentors in that old program that really helped me really understand what I was getting into, what it took to be successful in emergency medicine. And that really just gave me all the tools that I needed to have post-residency and beyond. Yeah.
So what made you decide to do a fellowship? Because I could be wrong here, but I think ER residencies are 3 years, just like a family medicine residency. Yeah. And a fellowship's not required. So what prompted you to do that additional training?
To be honest, I did not want to get into the ER and have to look up things on YouTube. I did not want to do that. Yeah. I felt more comfortable having additional training before going to an emergency room. I didn't feel like, I think in residency I did 4 months of, I did 2 months of core emergency room rotations, and I did 4 extra months of electives in the ER and like ultrasound and stuff like that. Yeah. So I didn't believe from my humble, everybody's different.
Sure.
Yeah. But I did not feel like I would be ready with only 6 months of emergency medicine under my belt. Okay. So I went ahead and then I did the additional year of fellowship to give me a little bit more training, and yeah.
And I wasn't aware that was a thing in the metro. So is it through OU that you did that fellowship?
No.
How did you do your fellowship?
So I did my fellowship. So my fellowship is actually hosted by Integris.
Okay.
Integris, Yukon Canadian Valley,
Yes.
and in Edmond. Integris Edmond.
Okay.
So they're hosted by those 2 hospitals, but they actually have a partnership with Team Health. So it's a Team Health / Integris kind of program going on there. Yeah.
And so is it typically a non-ER primary care person that comes in and does that every year, or is it more typically an ER person who fills that slot who wants more advanced training?
It's usually either a family medicine trained person, or sometimes they take internal medicine training.
Oh, wow.
Yeah, which is a little interesting because they don't do kids.
Well, it'd be interesting because what if a pediatric
They don't
patient
do
walked in?
kids.
Exactly.
Yeah,
They don't do
yeah,
kids and
yeah,
don't do the obstetrical things that are going to come.
But some of the graduates, some of the people who graduate from our program, who were internal medicine trained, are actually thriving. They're doing very well in the community. So it's just because you're internal medicine doesn't mean that you can give up on that dream if you have that dream. Yeah.
Fantastic, sir. So one of my questions was do people, when you walk in, do they know you're a family medicine trained ER doc? No. Okay.
No. So there are actually a couple of people in my group, right? I've been working in that group for, let's see, about a year and a half. There are some people in my group that I just found out last week that they're family medicine trained.
Oh, wow.
Doctor. Yeah. So nobody really cares as long as you're doing the job correctly.
Right.
Nobody knows. Nobody cares. Nobody asks. It's just go there and you do your work. Yeah.
I mean, do you feel like, when you probably have colleagues and you work with the ER trained physicians or internal medicine that transition to ER, do you feel like your family medicine training gives you a unique perspective in the ER, a different perspective? Yeah.
Absolutely. I think it becomes with communication.
Yeah.
Just the way we communicate with patients is a little different than the way emergency medicine trained physicians are trained to interact with their patients. I think, and please, I don't want to get anybody upset here,
Right.
but I think they focus a lot on speed and efficiency.
Right.
And we focus a lot on building relationship. Now, in the ER, you don't have time to build relationship.
Right.
However, you can use those skills to break barriers between you.
To build some degree of rapport.
Exactly. And I think that affects the care of the. I think they're more open to you. They're more open to being truthful, and I think that affects their care in a positive way. Yeah.
It's beautiful.
Are there any, in that same vein, are there any procedural skills or diagnostic approaches or tools you picked up during your family medicine residency that have been really applicable in the ER setting?
Well, maybe not procedural, but I think family medicine, we have a better grasp of how to handle chronic issues. So when people with chronic issues come to the ER, I think I manage them a little bit differently. For example, let's talk hypertension, high blood pressure, okay? somebody comes into the ER, blood pressure is elevated. Me as a family medicine trained ER doc, I know that, okay, maybe in the long run, X medication would be better than just sending them home with hydralazine to be taken or clonidine to be taken as needed. Yeah. So those aspects, or let's say I'm discharging somebody with diabetes, for example, and we need to do a little bit of tweaks here and there on their medication. I think as a family medicine trained physician, I'm more comfortable doing that than an ER doc who is used to acute, care.
Yeah. Excellent. Well, Doc, it's been great hearing this so far, and there's a lot more we want to talk to you about, but we're going to need to take a break. So Fast Talk fans, thank you for joining us, and we'll see you again next time for more of our conversation with Dr. Kouandjio.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.